Ladies and gentlemen, we'll proceed to the next order of business. Our next guest directs a healthcare system with an annual budget of $68 billion and is responsible for overseeing the delivery of care to more than 9 million enrolled veterans. She has a diverse background in healthcare administration and delivery, to include clinical practice, hospital practice and administration, managed care, pharmaceutical medicine, and healthcare policy. Please welcome the Acting Undersecretary for Health at the Veterans Administration, Dr. Poonam Alaigh.
Thank you, everyone. What an amazing, amazing speech by our president and his commitment to all the veterans in our VA healthcare system. Round of applause for our president. Okay, let's just see. Just trying to technically see if this is working, but if not, no big deal. First of all, I do want to thank everyone for being here. My most important identity is as a physician in the VA, and I've learned so much from all of you, from all the veterans, whether it was part of my training or whether it was part of my weekend work that I do, where I see my veterans in the nursing home, or whether it's the opportunity that I have and the privilege I have of leading the nation's largest healthcare system in changing the healthcare delivery for not just the veterans, but also for the whole country. So it is a true, true honor and privilege to be here and to be serving all of you. I do want to thank Commander Schmidt for his leadership. And I have to tell you, the American Legion executive team with Verna and Lou are just tremendous in terms of how we're working shoulder to shoulder to bring about transformation and solutions to our healthcare delivery infrastructure. And I can reassure you that your voices are heard every single time as we're coming up with changing programs, as we're coming up with improving our choice program or improving our outreach when it comes to suicide prevention and other key initiatives that all of you are involved with. You are represented so well with the executive team, and as a result of our constant interactions, we go back to the drawing board and come up with a design and a plan and a policy as a result of hearing from you through them. And so, again, a tremendous, tremendous contribution that all of you have directly into how VA will continue to improve care and lead change. It's not just as part of what we do formally as in DC as we're coming up with innovative solutions. It's also what you do at the grassroots level and as you help to champion change when we're delivering care in our medical facilities. Your program, the System Worth Saving program, which again, I know PNC Conley and Chair of the VANR Commission, Ralph Bozzella, is so tremendous in their leadership and ensuring that we at the VA medical facilities are getting that unbiased outside perspective on what's working and what's not working is so valuable as we're improving healthcare. Healthcare, as you know, is going through a lot of transformation as such, but as a result of the American Legion and programs like the System Worth Saving program, we know in real time when to work together and how we fix things before they become huge crises. One of the things that had happened in the recent past is in DC, in the medical center in DC, and many of you may have heard of some of the challenges that we faced in the medical center. And Verna with her team was right there with us as we spoke to the leadership, as I sat down with the frontline workers to understand what was working and what wasn't working. And then it was your American Legion and your VA that got together and had town halls where Verna, again, chaired that town hall, and we heard directly your voices around how we needed to change and what were the root causes of some of the challenges that we were facing. So thank you for being such a great partner as together we're evolving and transforming our healthcare delivery so that our VA system is not just preserved, but it absolutely is our crown jewel for the country. Our foundational services continue to get strengthened, and we invest in the care that you so deserve and need. So what are we, the VA healthcare system? So just to give you a perspective on the enormity of who we are, we have over 300,000 employees. We have 25,000 physicians. We have 65,000 nurses and healthcare professionals. We have over 75,000 volunteers that work in the VA. We have over 1,700 access points, 168 medical centers, over 300 vet centers, all of them the fabric of what the VA system is, the fabric of the system it belongs to you, the fabric of the system that leads change. In addition, we have 70% of physicians, one of them being me, who trained at the VA. We have 1,800 academic facilities that partner with the VA. We have 125,000 healthcare professionals that every year get trained in the VA, and in over 40 different disciplines. So you can see how important and how critical we are to not just the VA system, but to the fabric of our entire country when it comes to delivering healthcare. And something that I always tell my veterans, my patients, that I truly am so honored to treat and be there for, is that they've not only served once, but they continue to serve as a result of teaching me and teaching so many people like us around what works and what doesn't work and how we have to evolve the system. We serve over 9 million veterans, and we have 100,000 veterans who work in the VA. So the VA taking care of the VA, that's what it is, the veterans taking care of our veterans. They're the ones who understand what the issues are. Our veterans, all of you know, you've walked in those shoes of what it means to have served and in many ways sacrificed. And I have to tell you, when everything else is gone, the veterans, for my patients, when they've lost as a result of medical illness their memory or their thought process, the thing that stays is the fact that they've served. And so the changes and the impact that your service has made, not just to you, but to all of us, is something that is sustainable and it continues into the future. So what have we done so far? We've embarked upon a journey where we've come about a rapid transformation. And every month, ever since the Secretary took office, the leader that we have, we've actually impacted and changed things on a fast-track basis. So in February, he became the Secretary. Very soon after that, we've seen successive changes. In April, we launched the Access website. That's the site, if you guys haven't been on that site, you have to go on that website. It's the Access to Care website. It gives you the tools to empower you so that you can compare what the wait times are, what the satisfaction surveys are, and what the quality is in your medical center compared to others, and in many times compared to those in the community, the private hospitals in the community, so you can choose where you want to get care and how you want to get care. Again, every month we've seen major changes as far as what we've been doing. In April, we had the accountability legislation. In June, we had a whole bunch of other things that we've been working on. In July, for the first time, we opened up our panels to the other than honorable. We also worked on making sure that we set up something called the VSO Advisory Council for Suicide Prevention. As the Secretary said, our #1 clinical priority is suicide prevention. And we can't come up with that comprehensive program until we hear from you directly around what's working and what's not working. We need you every step of the way as we're looking at these audacious goals in bringing about change that's going to be long-lasting and sustainable, and change upon which we're going to continue to build our VA system. As I said, suicide prevention is going to be key. Suicide prevention, there is no veteran, and I repeat, that should ever feel so alone and with so much of loss of hope that he or she resorts to this. We have to work together for this. For the 20 suicides that take place every year in our veteran population, 14 of them happen outside of the VA, where they have never had contact with the VA in the last year. So we have to do everything possible to band together as a community to help our veterans. We have to be there. We have to make sure that they have a purpose to live. They have something that they look forward to, that energy, that adrenaline rush that our veterans are so used to is reinfused in them. And we have to work together to make that happen. As part of that, there are other aspects of suicide prevention we're working on, whether it's substance abuse, whether it's taking care of PTSD, whether it's identifying risk before our veteran gets to the point of becoming suicidal. How do we help them before they get to that point? Those are the things that we're working on. We're spending lots of research dollars in understanding that. But in the meantime, all of us have to band together. I don't think there's a single person here who doesn't know of a veteran, either personally or have heard of a veteran, that has been impacted by a suicide. And we have to be there for their families. We have to be there for their loved ones. Access, as I said, is an important piece. We will continue to work on improving access. And not only do we have same-day services in all of our medical facilities, but we're embarking upon this journey where we're committed to having same-day services in our C-box also. So when you, as the veteran, need care, and you decide you need care, you should be able to get it at the same time. This, again, is a high bar, but you deserve it, and we're committed to making that happen. In addition, the Anywhere to Anywhere program, where we again launched that just this month with the President and the Secretary, is a very important program. It's about being able to get care anywhere, no matter where you are in the country, and not have to drive into your medical facility or your C-box to be able to get care. If you choose to have care using a smartphone or a mobile device, then you should be able to get it using a secured Skype or FaceTime-like technology, which we just launched. And we're so proud of this because this also helps our healthcare professionals. They don't have to be in the medical center to render care. It could be after hours, it could be weekends, but if you wanted to talk to your physician or your healthcare provider, you should be able to do that. And we have studies that show 70% of issues can be resolved by just a quick face-to-face virtual care visit that we can launch using technology like that. That is so important, to be able to render care in your terms based on what you find convenient when you want the care in the way you want the care. So no physician in a VA or a nurse in the VA should say, no, you don't need care. It cannot be a paternalistic culture. It has to be a culture where you're in the driver's seat and you're leading the care decisions that's personalized to you. And so this is another huge advancement. And the choice program. We've heard about the choice program from all of you. It's a program that has helped meet the needs today, but it is not the program that will continue to bring about a high-performing network and a high clinically integrated program if it continues without change. We have to take the insurance companies, we have to take the Tri-West and Health Net out of the middle of the care that your physician and your community provider want to work on. So the new program that we're launching, where again, the American Legion under Lou and Verna's leadership have worked so hard with us. And I have to tell you seriously, they had us go to the drawing board 4 times before it became acceptable. That's the program that we're about to release. And that's the program where your physician inside of the VA, with you in the driver's seat, works with the physician in the community to make sure you're getting the best care, whether inside of the VA or outside of the VA. And the electronic health system will help with that, because the electronic health system right now, a decision that's taken over a decade to make, we've been able to make that decision in the few months that the Secretary has been in office. In June, we announced our intention. That was the other big thing that we did. In June, we announced the intention of working with the same electronic healthcare system that DoD has. So from the time that you get enlisted to the time you serve in the military and post-military service as a civilian and a veteran, we have your longitudinal healthcare records. So whatever happened in military service or before that, we have a way of looking at what that impact will be in terms of your prognosis and your course of illness as a result of having all your electronic health records on one platform. And this is something that, again, no other healthcare system has ever done or is able to do. One of the other things we're trying to do is bring the community providers, the choice care providers, into this mix, so that the electronic health system is going to be there on one platform from DoD to VHA, whether it's inside the VA or outside of the VA. Again, will reduce a lot of the bureaucracy, a lot of the redundancy, a lot of the fragmentation in care. It'll help coordinate the care better as a result of it. And something that I'm really proud of that we're just starting to sort of dabble in is something called whole health. And it is so important that as we're caring for you, as our system is caring for our nation's heroes, we are making sure that we're not just empowering you with putting you in the driver's seat, but we're also equipping you with the system and the resilience that you need by integrating care using integrative medicine, like your Tai Chi, like your meditation, like your mindfulness, so that you can deal with adversity better. You can deal with the inevitable better. And you become stronger inside to be able to take care of your illness. And again, you have that positive mindset that no matter what happens, we're going to win. You're going to win when it comes to taking care of your health. And that's the whole health model we're building, and we're really excited about it. One of the things that comes out of the whole health model, which again is going to be key, and I've worked most of my professional career in geriatrics with nursing home veterans and patients. One of the things that we're so committed to do is making sure that we provide all the resources possible so our veterans can live in the home and community-based setting, and they don't, as a default, have to be admitted into the nursing home for the rest of their lives, unless that's absolutely needed. You know, I see my nursing home patients, and I have to tell you, there's so many of them that inspire me, so many of them that have taught me so much. And one of the things they tell me is that the system has failed when there's nothing available for me to be at home, when I have my wits, when I have my functioning arms and legs, but I need a little bit of help so that I can be safe at home. And the system doesn't provide me that. And as an immediate resort, I'm put into a nursing home. So we can't do this. It is for my veterans, for my patients that I take care of on weekends, that I am committed to making sure that we provide everything possible, a system of support, so that the inevitable, when we get to that point, all of us will one day, and we have to make that decision. We are in the home and comfort of what makes most sense to us based on our personal values and our personal preferences. So I'm committed to making sure that we provide that to you, all of you. And the Million Veterans Program, again, remember we have 4 principles, core mission principles here at the VA. One is our healthcare system, the second is our research, the third is our training, and we went through how much we do in terms of training the American healthcare professionals, and then the emergency preparedness. The research piece is like the Million Veteran Program, where today we have over 600,000 blood samples that we could do genetic analysis on as a result of all of you continuing to contribute. And that connected with our healthcare, electronic health records, that connected with our social determinants of care, our lifestyle history, our military history, all together provide such valuable databases where we will be seeing breakthrough research and cure of disease that we could never have even fathomed in the past. And it's because of all of you, and again, your service to the country that you continue to commit to, that we're going to be able to change the care and come up with so many different advances around our chronic conditions that will help to improve not just the age, but also our longevity, our wellness. It is so important as we grow older to have 3 main things in life, to be able to have the richness and quality of life no matter what happens. And you do this through the American Legion. The 3 main things is getting up every morning with a purpose, having that fire inside you to serve and have a purpose. Secondly, to be connected as a social network. And I see you as I walk down the halls, all of you connecting together. It's family. I come here, I feel like this is family. All of you are connected socially and are there for one another. And the third piece is that spirit of constant service. So you have a purpose, you are socially connected, and you have that spirit of purpose. And so it's going to be so important to make sure that you stay strong, because I'm going to need you as we continue to go down this transformation journey. And this is my commitment to you on behalf of the VA. There are times, and there will come a time in all of our lives when we're most vulnerable, when we feel most feeble, when we're most frail, where mortality is looking into our eyes. But I can't thank you enough for allowing us to enter that space, that personal space, and doing a small bit in terms of serving you as we all go through this journey of the inevitable. But here, again, thank you for your service. We are there for you. We will continue to make sure that the VA healthcare system is strong and something that you're going to continue to be proud of. And again, thank you for your service.